if one of the unvaccinated residents, has an issue, then I'm quite happy to slow code them. And as you say, that actually means they would take the time, stand back and watch them die. Now, as a retired police officer, that's an intent to commit murder. I mean, there's no other way of putting that.
Welcome back to the Neil Oliver Show. I want to speak now about concerns over the treatment of unvaccinated residents in Canadian care homes during the COVID pandemic. David Dickson, a retired Liverpool police officer and owner of a cybersecurity firm that's been instrumental in gathering government data, says he was told that a senior staff member at a care home in Edmonton stated that they would slow code any person who was unvaccinated, which means respond slowly or incompletely to a patient in cardiac arrest. I'm joined now by David Dickson to tell us more about what he learned about this. David, thanks for joining me. Slow code. That's a very sinister sounding instruction. Can you elaborate a bit on how you came to understand that's having been the process in place?
Yeah. So just like you've been hearing in the Scottish inquiry from Twitter followers like Dave and Russler over the last year or so, Canada went through the same process starting in 2020, locking down care homes, the fear ramping up to the point that healthcare staff were terrified to actually go in and deal with residents, even before we got to the vaccines. They were in hospitals, patients were left for hours upon a time, crashing with nurses saying, I'm not going in there, I might catch COVID. So willing to let people die. That sort of, as we got into the vaccine rollout, sort of exacerbated with not only, people who didn't wear a mask were considered pariahs of society, but if you didn't get vaccinated, you were, even worse. And there was one incident in Edmonton where an actual manager, a unit manager, was overheard and was not smart enough to realize that what she was saying was in an area that was covered by a camera, and actually said to another member of staff, if one of the unvaccinated residents, has an issue, then I'm quite happy to slow code them. And as you say, that actually means they would take the time, stand back and watch them die. Now, as a retired police officer, that's an intent to commit murder. I mean, there's no other way of putting that.
No, we haven't seen the audio and the video that to which you're referring. But so I mean, I have to and we don't have a response, a statement back from the care home in question. But I think the mere fact that a form of words had been decided upon, this slow code. Now, correct me if I'm wrong, but it was reported, wasn't it? This was reported was it the October of 2021 that. Yes. Slow code was supposedly official response to people with cardiac arrest or unable to breathe, and that nothing was done.
So we're focusing on just one little aspect of all the things that went on in the care homes. Slow code is actually a term that's been used in healthcare for a long time, but it became sort of a relatively standard response for people who were, it's a way of choosing who lives and who dies. I suppose one of the things that it's important for people to understand is we're talking about this right now as like one incident and in the past tense. This isn't past tense. Once we finish this interview today, I'm heading up to the care home in Edmonton, which is on full COVID lockdown. Residents locked in their rooms, 25 residents in one unit, locked in their unit behind closed doors, masks, face shields, goggles, gloves, gowns, sanitizer, restricted in and out, with 3 patients, one of them who doesn't even have symptoms. And that's still happening today. These are the things that happened in 2020 and 2021 are continuing to happen today. And because of this ongoing fear campaign that, you'll die if you don't get vaccinated, you'll die if you don't wear a mask, it's become ingrained across the world. If you actually look at the UK or Scotland's current protocols for care homes, they're identical to here. 2 cases, which is basically 2 people who sneeze in a 14-day period or 10-day period here, and they lock down the whole unit. Everybody in it is now restricted, as bad, if not worse, than they were in 2020. And that's what really killed people. Not just responding slowly, but actually locking them in their room, failure to thrive.
Is the majority of the Canadian population on message with this, or is there across the board COVID fatigue? Let's just put this where it belongs, which is, we no longer have to behave in this way, and there are much more important questions to be asked about, the actions that were taken, the legislations that were put in place, the experimental gene therapies that were all but mandated for whole swathes of populations.
Yeah, so the biggest problem is that the majority of the population doesn't know this is still happening. We have a weekly dashboard, and yesterday I did the data for Alberta, as I do for all countries. And we've reported, it's been reported in Alberta that there's been over 700 COVID deaths since October. Now, those COVID deaths are defined as anybody who dies for any reason within 60 days of being put into the system as a COVID case. Even the COVID case is a bit, it's based on what you call lateral flow tests, we call RAT tests, rapid antigen tests. So you had 28 days. We have 60 days here. We've had 150 flu deaths and over 700 COVID deaths, but nobody is talking about it. And behind the scenes, in the hospitals and in the care homes, these COVID restrictions, which are actually more restrictive now, but they're not general. So I'll be going to the care home this afternoon. There'll be a sign at the front door saying one of the units is on lockdown. But other than that, if you wander around the units, you wouldn't know that COVID even existed or anything existed. Everything that is going on is normal. People are walking around, no masks, no nothing, until you get to the unit that's on outbreak. And this is the same in hospitals. You suddenly hit a wall, a locked fire door, which is illegal in itself. And you can't go through that door unless you put on a mask and a face shield and gowns and gloves and hand sanitizer. And I was locked out of the care homes despite being my mother-in-law's medical proxy for 1,193 days because I can't physically wear a mask. I've got a medical exemption and everything. I've got pulmonary fibrosis. And I actually used to sit in the car park in the middle of the Canadian winters at minus 45, talking to the doctor inside the building about my mother-in-law's medical care because I wasn't allowed in the building. This didn't even get to vaccinated or not. They, in some centres, they included vaccinations, but this is as bad as masks. And right now, officially, if I go in, I'm not, there's a sign on the door of one of the units that says nobody beyond these doors without a mask and a face shield. Now, I've met with this CEO of Capital Care, the largest care home group in Alberta and one of the largest in North America, and told them you can't do that. It's illegal.
David, I'm going to just have to jump in for shortage of time, but I cannot stress to you the extent to which I think it's so important that you've brought this to my attention. So important that this insanity is endemic in Canada and that more people don't know about this lingering after effect about people behaving in the wrong way and continuing, like here, to fail to ask the relevant questions. Thank you, David Dickson, for joining us today.
It's still it's still happening in the UK and Scotland as well. It's not just here.
It's so important that you turn that light on it. Thank you so much, David Dickson.